molecule which is used in the management of hyperlipidemia. That is, whenever the fats, mainly cholesterol and triglycerides, are increased in the human body. Now, the drugs which are used in this category are various drugs. One of them is an important subset, and that is called as statins. There are various types of statins: lovastatin, simvastatin, atorvastatin, rosuvastatin, etc., etc. So today we are going to learn more about an important statin molecule, that is atorvastatin. Now, what is atorvastatin? Atorvastatin, as I've said, it belongs to a group of medicines called statins. And these are fat regulating or lipid regulating medications. Atorvastatin is used to lower lipids known as cholesterol and triglycerides in the blood when a low fat diet and lifestyle changes on their own have failed. If you are at an increased risk of heart disease, atorvastatin can also be used to reduce such risk, even if your cholesterol levels are normal. You should maintain a standard cholesterol lowering diet whenever you are taking atorvastatin. What you need to know before taking atorvastatin: please do not take atorvastatin if you are allergic to atorvastatin or whatever maybe inactive ingredients are there in the tablet formulation. Secondly, if you have or have had any time in the past some disease or diseases which have affected your liver, or if you have had any other unexplained abnormal blood tests for liver function. Also, you should use the combination in case you're using the combination of two drugs called glecaprevir and pribendacivir. These drugs are used in the management of a condition of liver called hepatitis C. So if you are taking this combination, please do not take atorvastatin. Now, what are the warnings and precautions one needs to understand when one is taking atorvastatin? Please talk to your doctor before taking atorvastatin if you have had a severe respiratory problem. It is specifically known as respiratory failure. Or if you have been taking or have taken in the last 7 days a medicine called fusidic acid. Now, this is a medicine given for a bacterial infection. It is given orally or by injection, but whenever you are going to take it, please do not take atorvastatin because it can lead to multiple muscle problems, which I am coming to a little later. Or if you are having, or if you have had a serious previous stroke with bleeding into the brain, or if you are having small pockets of fluid in the brain which have arisen from the previous stroke, that is paralysis. If you are having kidney problems, if you are having an underactive thyroid gland, that is called as hypothyroidism. If you have had repeated or unexplained muscle aches or pains, a personal or family history of muscle problems. If you have had any problems of muscles which are requiring lipid lowering medications of other types, they are called as fibrate medicines, etc., etc. Or if you drink large amount of alcohol, if you have had a history of liver disease, or if you are older than 70 years. So if any of these apply to you, your doctor may require to carry out a blood test before and possibly during your atorvastatin treatment to predict your risk of muscle-related side effects. The risk of muscle-related side effects, particularly rhabdomyolysis, I'm coming to that a little later. So this is one of the very important muscle disorder which can arise because of use or consumption of atorvastatin. So the muscle-related side effect risk is bound to increase when certain medicines are taken at the same time, along with atorvastatin. So additional tests and medicines may be needed to diagnose and treat this. While you are on atorvastatin, your doctor will monitor you closely. If you have diabetes or if you are at the risk of developing diabetes, you are likely to be at risk of developing diabetes if you have high levels of sugars and fats, that is hyperglycemia and hyperlipidemia in your blood, if you are overweight, and if you have high blood pressure. Which are the other medicines you require to keep in mind if you are going to take them, or if you are required to take them along with atorvastatin? Please tell your doctor if you are taking them, or if you have recently taken, or you might take in the future as well. Without prescription also, certain drugs are like for example, St. John's wort, etc. So there are certain medications which may change the effect of atorvastatin, or their own effect might be changed by atorvastatin. That is called as drug interaction. So this type of interaction could make one or both the drugs less effective. Alternatively, it could increase the risk of severity of side effects, including the one which I mentioned a little earlier, that is rhabdomyolysis. So which are the medicines which you have to be careful? You have to tell the doctor when he has prescribed atorvastatin for you. There are certain medicines which are used to alter your immune response. For example, cyclosporin. Then certain antibiotics or certain antifungal medicines like erythromycin, clarithromycin, ketoconazole, itraconazole. These are some antibiotics as well as antifungal medicines. Or other medicines which are used to regulate lipid levels. For example, certain fibrates, then cholesterol, etc. Then certain drugs called calcium channel blocker. These are used to treat high blood pressure. These are used in coronary artery disease, etc. And the examples of these are amlodipine, diltiazem. Then there are certain medicines which are used to regulate your heart rhythm. For example, digoxin or verapamil or amlodipine. Then letermovir. This is a medicine which helps you to not get a viral infection, very important viral infection called cytomegalovirus. It is called CMV in short. Or medicines which are used in the management of HIV, that is AIDS. They are called VIRs, means ritonavir, lopinavir, etc., etc. Then some medicines which are used in the management of hepatitis C, which I have already mentioned, like elbasavir, grazoparivir combination, etc. Your doctor will tell you accordingly. Then other medicines are also known to interact with atorvastatin. For example, ezetimibe, which is used to lower the cholesterol, or warfarin, which is used to reduce blood clotting, oral contraceptives. Then cimetidine or ranitidine. These are drugs used for hyperacidity. Then colchicine, which is used for gout, and certain antacids, which contain aluminum or magnesium. So all these drugs we need to understand, and we need to inform the doctor if you are already taking it. Now, very strange and interestingly, grapefruit juice, which we use very commonly. So grapefruit juice, please remember, do not take more than 1 or 2 small glasses of grapefruit juice per day, because large quantities of grapefruit juice can change the effect of atorvastatin. Alcohol. Please avoid drinking too much alcohol when you are on this medicine. Now, what about driving and using machines? Normally, this medicine, that is atorvastatin, it does not affect your ability of driving or operating machines. However, do not drive or do not use any machine if you feel that this medicine, that is atorvastatin, is affecting your function or ability to drive or to use the machinery. Do atorvastatin tablets contain sodium? Yes. 10, 20, and 40 milligrams, these are the ones which are commonly used. These are the strengths of atorvastatin. They contain less than 23 milligram of sodium per tablet. That is, practically these strengths are sodium free. Now the highest strength, that is 80 milligram of atorvastatin, contains about 26.9 milligram of sodium. But remember, this is equivalent to just 1.1% of the recommended dietary intake of sodium for an adult. So practically, the sodium content of atorvastatin is not going to influence your sodium levels in the body. Atorvastatin tablets. Please remember, before starting the treatment, your doctor will place you on a low cholesterol diet, which you should take care to also maintain during the therapy of atorvastatin. The usual starting dose of atorvastatin is 10 milligrams once a day in adults. 10 milligrams once a day in adults. This may be increased by the doctor if necessary to bring down the lipid levels to normal. This sort of change or modification of dose is generally done only after 4 weeks, so not within 10-15 days. The maximum dose of atorvastatin recommended is 80 milligrams per day. Atorvastatin should be swallowed whole. The tablet should be swallowed whole with a glass of water and can be taken at any time of the day with or without food. But there's a catch here. It's said that all the statins, including atorvastatin, are more effective if they are taken after 7 p.m. in the evening. So try to take your tablets of atorvastatin after 7 p.m. in the evening. Try to also take the tablet at the same time every day. Check whether you are taking the tablets exactly as per your doctor has told you. You should also check with your doctor if you are not sure. The duration of atorvastatin tablets is determined by your doctor. So therefore, please ask your doctor if you feel that the effect of atorvastatin which you are taking is either too strong or too weak. Now, what happens if you take more atorvastatin tablets? Accidentally, maybe. So if you are taking more atorvastatin tablets, more than your usual daily dose, please contact your doctor or the nearest emergency or casualty department of a hospital. If you forget to take atorvastatin, what happens? If you forget, just take your next scheduled dose at the correct time. But please do not take a double dose to make up for the forgotten dose. If you stop taking atorvastatin tablet, what happens? Well, if at all the doctor has told you to stop, it's a different story. But on your own, if you want to stop for various reasons, you should not stop them without consulting or informing your doctor. Now, what are the possible side effects with atorvastatin? Well, like all medicines, atorvastatin also has side effects, but it's not necessary that everybody gets them. So if you experience any side effects, please inform the doctor. Then particularly the serious side effects of atorvastatin. Stop taking your tablets and immediately inform your doctor, or go to the nearest hospital, emergency or casualty department. Now, what are these serious side effects of atorvastatin? They are relatively rare. For example, they may affect 1 in 1,000 people. Like serious allergic reactions, which cause swelling of the face, tongue, and throat. It's called as angioedema. It can also cause severe difficulty in breathing. Then there can be serious illness with severe peeling and swelling of the skin, blistering of the skin, mouth, eyes, genitals, and also associated fever. Skin rash with pink or red blotches, especially on the palms or hands or soles of feet, can also blister. Muscle weakness, then it's called as tenderness, means if you press the muscle, it starts giving you pain. That's called as tenderness, or actual pain within the muscles, rupture of the muscles, or reddish brown discoloration of urine. And particularly so if you are having high temperature and if you feel unwell. So all these things, if you are having, they may be rare, but at the same time, the doctor needs to be informed. I was telling you about rhabdomyolysis. Now, rhabdomyolysis is a very serious side effect of atorvastatin, and it occurs because of abnormal muscle breakdown. The muscle gets destroyed, the muscle gets dissolved. So it's called as rhabdomyolysis. And what is more important is it may not always go away, even if you have stopped atorvastatin, and it can be life-threatening and can lead to kidney problems. And therefore, if you have all the problems which I told you earlier, please do not hesitate to contact the doctor. There are certain very rare side effects which can affect 1 in 10,000 people. So we are rather now concentrating more on the commoner side effects, which may affect 1 in 10 people. So what are the common side effects of atorvastatin, which may affect maybe 1 in 10 people? One is inflammation of the nasal passages, throat pain, nosebleed, allergic reactions on a milder scale, which I told you earlier. Increase in blood sugar levels, particularly if you are pre-diabetic. Increase in an enzyme in the body called creatine kinase. Headache, nausea, constipation, wind passing, indigestion, diarrhea, all these are gastrointestinal side effects. Joint pain, muscle pain, back pain, and blood test results that show that your liver is not functioning well. So there could be some abnormal results. So these are the common side effects which occur with the consumption of atorvastatin.
You can talk to me.
I told you that there are some rare and very rare side effects which can occur in 1 in 1,000 people, 1 in 10,000 people. So we just keep them in mind, but that is for the doctor to decide. So whenever you are getting such sort of side effects, or even if you get certain effects or side effects which I have not mentioned, please don't hesitate to contact the doctor. Now, how to store atorvastatin tablets? How to store atorvastatin tablets? Please remember to keep this medicine out of the sight and reach of children. Do not use atorvastatin tablets after the expiry date, which you know is normally printed on the strip as well as the box. It's called as carton. It's called as expiry date. This medicine, frankly speaking, does not require any special storage conditions. But at the same time, please see to it that you don't keep it in sunlight or you don't keep it in a very moist, humid climate. And do not throw away the medicines via wastewater or household waste. Now, how is atorvastatin available? As I said, the active substance in any atorvastatin tablet is obviously atorvastatin. And this is given in the salt form, which is called as atorvastatin calcium trihydrate. So these tablets are film coated. So it's available in the strengths of 10 milligram, 20 milligram, 40 milligram, and the highest strength is 80 milligram. And of course, they are combined with certain inactive drugs to give the tablets a little more of stability and firmness. So this is called as inactive ingredients. And these are mostly available as strips of 10 tablets. I hope that with this information, you'll be able to take atorvastatin with greater confidence whenever it is prescribed to you by your doctor. Thank you.